Okay.
As you can see, first thing, peel off the paper from the back. And then inside you have different components. You have the needle here. You have the extraction cannula here. Here you have the tool to measure how much sample did you collect, and then to push out the sample from the cannula. This is a tip cover in order to be safe when using the needle and putting your hand near the tip. So you can put here this tool in order to protect yourself from the tip, with the cutting tip of the needle. And then you have other components that will be used to close the needle after the usage. So first thing, you take the needle, take out the protection. First thing, the doctor will practice a cut on the skin of the patient, and after doing this cut, he will enter with the trocar inside the skin. He will go inside the skin until he will reach the bone. Once he will reach the bone, you will feel the hardness of it when pushing down the needle. So the doctor will do something, a movement like this, in order to penetrate inside the bone. Once the first layer of the bone, which is the hard one, has been passed, the doctor will feel a loosening of the tissue when going down. As soon as you can feel the loosening, you have to stop penetrating with the needle inside the bone. You will rotate the cap, extracting the trocar. Then you will need to go down about 2 centimeters in order to collect a good sample. So the doctor will go inside the bone like this. Once inside, the doctor can also measure how much sample did he collect. Starting from this, see, by looking at how many markings stays outside the needle, you can understand how much centimeter is long your sample. So in this case, you will have 1 centimeter samples inside the needle. So we go down again a little bit. You measure again, and here you see that here we have 1.5 centimeters. Done this, the doctor will take the extraction cannula. Here you will have also a side marked by an arrow, which means this is the upper side. You insert the cannula inside the needle, pushing it down until it stops, until the end, all the way down. At this point, you will have to rotate all the system clockwise 2 times, a complete turnaround, and then counterclockwise. In this way you will detach the sample from the bone. Done this, with this needle, the doctor will have to come out from the bone completely. Done this, you can look at the arrow on the extraction cannula. Be careful that the arrow is pointing toward the up.